Hi, everybody. Thanks for hanging in here for the tail end of the SAGES conference. I'm Dr. Szoka. I'm a bariatric surgeon from Morgantown, West Virginia. So happy to be working with Dr. Stephanides on this panel. I'm going to do just a really brief overview of the importance of DEI in healthcare, and just to help frame the discussion for the rest of the session. Here are my disclosures. And so when we think about healthcare disparities, I think of a few larger buckets to put that healthcare disparity concept into. Number one, patient-related healthcare disparities. Number two, workplace and provider-related healthcare disparities. And number three is sort of disparities in education for providers. But first, so for bucket number one, we know that patients suffer healthcare disparities in the following areas. So number one, having access to care. So do they have insurance? Do they have any healthcare facilities around them? Number two, they may have access to care but have negative experiences while they're actually getting their healthcare, just based on maybe physicians not interacting with them in a culturally competent way. And of course, the thing with this disparity in healthcare in terms of access and receiving care is then these negative elements lead to public health implications. So kind of failure of the whole system if we're not able to provide healthcare for the full population. And we can see just this example is just who's received the COVID vaccine. And so there are disparities in terms of like race, ethnicity. And it's just an example of, yes, we have a large amount of healthcare disparity going on in our country. Bucket number two is just healthcare disparities for providers. And so what I would say is that patients generally like to see physicians who look like them. And there's a lot of data showing that patients say the quality of care they're given or it may be improved if the physician workforce looks like them. And what our goal should be is that the diverse population should then be reflected in a diverse physician population. And I think reflecting on this, obviously we need an increase provider diversity. And initially I thought, this starts with medical students and med school recruiting. But even that, I would say this demand should start before that, because if, sensitive populations are not even thinking that they are candidates for medical school, they're never going to go that direction. So I would say this push for diversity should be starting probably at a high school or in college level to help raise up, a diverse physician workforce. And then the right side of the slide is on the other side of training, there is a lack of diversity in healthcare leadership. And so, the top image, pardon me, the top image just shows that, for example, for women, in the healthcare workforce, a lot. In terms of actually being in leadership positions, that drops. And then also, you have intersectionality, so a woman who is, also a minority or a person of color, that access to a leadership position continues to drop. And so that's another systemic problem that, we need to think about. I think just the bottom here is for leadership, specifically diversity in leadership, we need more mentorship to drive those things forward. And then just to frame the rest of the conversation, again, just thinking about these factors. So in terms of DEI, we need to really understand our own biases. So explicit, cognitive active reasons, these groups are being excluded. And then implicit, so those are subconscious biases that everybody has. This concept of minority stress, there's a lot of data that shows that underserved populations have a lot more stress based on that status, and that leads to poor health outcomes. And then this concept of intersectionality. So when you have overlapping groups, whether it be differences in socioeconomic status, race, ethnicity, as those things add up, the quality of healthcare goes down. And so that's where there's a role in guidelines to kind of bridge the gap for improving or advocating for access for these groups.